Welcome back to Learn Nursing with Anila, Dosage Right Series 2. In this episode, we will learn a simple formula that helps you all calculate the right medication dose. Why drug calculation is important? Drug calculation is important to ensure patients receive the correct dose, preventing underdosing, overdosing, and medication errors. The basic formula is dose to give is equal to prescribed dose divided by available dose into available volume. It includes the amount ordered by a doctor, the strength of medicine, and the liquid or tablet form of medicine. If it's your first time here, don't forget to hit subscribe, like, and turn on the bell icon. Let's do a liquid medication calculation. Doctor prescribes 500 mg of a drug. The available bottle says 250 mg per ml. Calculate the dose. Prescribed dose is 500 mg. Available dose is 250 mg. Available volume is equal to 5 ml. Here we need to use the basic formula 500 divided by 250 into 5 ml. So that is 10 ml. So we need to give 10 ml of that medication to the patient. Let's move on to a tablet calculation. Doctor prescribes 1000 mg of a drug. You have 500 mg of tablets. Calculate the dose. Prescribed dose is equal to 1000 mg. Available dose is equal to 500 mg. The formula need to use tablets to give is equal to prescribed dose divided by available dose per tablet. That is 1000 mg divided by 500 mg, that is equal to 2. You need to give 2 tablets to your patient. Here are some frequently asked questions in nursing competitive exams. Feel free to reach out if you need solutions or explanations. Accurate drug calculation is essential for patient safety, and by using a simple formula, a nurse can confidently administer the correct dose every time.